Have you ever noticed that your back pain didn't start from one heavy day of lifting, but from months or even years of sitting the wrong way? Each morning, it gets a little harder to twist your body or bend down to tie your shoes. You might even need to push yourself off the chair with your hands. Most people think it's just age catching up, but the truth is, these are early signs that the muscles supporting your back and hips are weakening. According to the American Academy of Orthopedic and Neuromuscular Health, over 70% of adults over 60 experience recurring pain in the lower back or hips. What's more concerning is that as hip muscles weaken, the spine begins to carry all the body's weight, creating pressure on nerves and joints. That's when every movement, standing up, sitting down, or taking a simple step starts to feel heavy and strained. Many of my older patients once believed that resting more would ease the pain, but in reality, staying still is what makes it worse. Muscles are like rubber bands. The less you stretch them, the tighter they become. The good news is, you don't need a gym, expensive equipment, or pain medication. All you need is a sturdy chair and 10 minutes a day to reawaken those sleeping muscles, release hip tension, and bring comfort back to your spine. The 5 movements I'm about to show you were designed specifically for adults over 60. They're gentle, safe, and scientifically proven to restore flexibility, improve circulation, and reduce stiffness. Bit by bit, these moves help you sit taller, move easier, and regain confidence in your own body. So if you're watching this right now, sit up straight, place both feet flat on the floor, and let's begin together. Because in just a few minutes, you'll feel your back loosen, your hips relax, and your whole body start to feel light again. 1. Gentle torso twist. If you've ever sat through a long morning reading or watching TV, and then tried to turn to grab something beside you, you've probably felt that tight pull across the waist or the dull ache in the middle of your back. It's one of the most common complaints I hear from people after 60. Doctor, I just can't twist the way I used to. And that single sentence tells me their spine and core muscles are starting to lose mobility. Something that affects everything from walking to breathing. The torso twist is a small, simple motion, but it helps to reverse one of the most under-recognized problems of aging stiffness in the spinal rotator muscles and the obliques. These thin sheets of muscle wrap around the sides of your waist like natural corsets. They support your posture, stabilize your balance, and allow your upper body to rotate when you turn to talk, drive, or reach for an object. When they stiffen, the spine can't distribute pressure evenly, and that's when pain begins to build up around the lower back and hips. Now, here's something few people know. Inside every vertebra are tiny joints called facet joints, coated with a slick fluid known as synovial fluid. After 60, the body produces less of it. Without motion, that fluid thickens, and the joints start to grind more than glide. Over time, this can feel like rust in the spine. Twisting gently and regularly helps warm up those joints, stimulates fluid production, and keeps the back supple. Let's go step by step. Sit on a sturdy chair, not a sofa, with both feet planted firmly on the ground. Sit tall so your spine stretches upward. But keep your shoulders relaxed. Place your hands lightly on your shoulders or across your chest. Take a slow breath in through your nose. As you breathe out, rotate your torso to the right. Don't force it. Imagine your ribs moving around a steady central axis. Hold the twist for about 3 seconds, breathing calmly. Then return to center. Inhale again, and exhale as you rotate to the left. Repeat the motion about 10 times on each side. As you do this, pay attention to how it feels. You should notice a mild stretch along your side and across your lower back, not pain, just gentle resistance. That feeling means the tissues are waking up. Oxygen is returning to the small muscles around your spine, and the stiffness is starting to release. Now, a quick doctor's reminder. Many people unintentionally make this harder by pulling their arms or jerking the motion. The moment you use momentum instead of muscle, you lose control and risk strain. So to keep it slow and smooth, as if your spine were a long ribbon you're gently untwisting. And never hold your breath. Breathing is your body's built-in tension release. Exhaling helps your muscles relax naturally. After a week of consistent practice, you might start to notice small but meaningful changes. You'll be able to turn more easily to look behind you while driving, or twist to reach something on the counter without feeling that sharp catch in your lower back. Those little victories are proof that your spine is regaining its flexibility, a kind of youthfulness from the inside out. Once this movement starts to feel comfortable, you can make it slightly more challenging. Extend your arms straight in front of you at shoulder height, palms together. As you rotate, keep your eyes on your fingertips. This adds coordination between your neck, eyes, and balance center in your brain. This variation not only improves spinal mobility, but also trains your vestibular system, which helps prevent dizziness and falls. There's a fascinating piece of research from the Nagoya Rehabilitation Center in Japan. In a 2022 study, older adults who practiced gentle rotational stretches for just 10 minutes a day improved the elasticity of their spinal muscles by 25% within 3 weeks. Even more impressive, participants reported less morning stiffness and better posture. It proves that small to consistent movements can produce results that no pill can match. Because when your spine begins to loosen, your chest and shoulders can finally open up too, and that's where our next move will take us. 2. Shoulder and chest opener. You might not notice it right away, but posture has a quiet way of changing over the years. One day you're standing tall and moving freely, and before you know it, the shoulders begin to round forward, the chest caves in slightly, and the upper back feels tight as if gravity has been slowly pulling you down. It's not vanity, it's anatomy. When the chest muscles tighten and the back muscles weaken, the entire upper body starts to fold in on itself, making breathing shallower and movement less fluid. That's why the second exercise focuses on opening the chest and freeing the shoulders. The goal here isn't just better posture, it's better oxygen flow. When the chest muscles loosen, the lungs expand more easily, blood gets more oxygen, and the brain receives a steady, healthy supply. The result, you think more clearly, your body feels lighter, and even your mood improves. Let's get into position. Sit tall near the edge of your chair with your feet flat on the floor. Clasp your hands behind your back if your shoulders are too stiff. Hold a small towel between your hands. Roll your shoulders back gently. Squeeze your shoulder blades together and open your chest. You should feel the stretch across your upper chest and down the front of your shoulders. Hold this position for 5 slow seconds, then release and relax. Repeat this 5 to 10 times, focusing on steady breathing. Now, let me share a small doctor's insight. Many people instinctively lift their chin or arch their lower back while opening the chest, but that's a mistake. When you arch, you're shifting the strain to your spine instead of your chest muscles. So keep your lower back neutral, your chin slightly tucked, and let the movement come from your shoulder blades. Think of it as ungluing your shoulders from the years of slouching. Once you get comfortable, you can move to a slightly more advanced version. As you exhale and squeeze your shoulder blades together, lift your clasped hands just an inch or two away from your back. This small motion deepens the stretch in your pectoral muscles and strengthens the rear shoulders. If you feel mild warmth spreading through the front of your chest, that's a good sign. It means blood is flowing where it hasn't in a long time. Here's something interesting most people don't realize: your posture directly affects your breathing rhythm. Studies from the American Journal of Respiratory Health show that adults who improved their chest mobility could increase their lung capacity by up to 15% just by sitting upright and opening the chest daily. That's not a small change. It's the difference between feeling tired at noon and staying alert through the afternoon. As a neurologist, I often remind my patients that this exercise also has a surprising benefit for the brain. When you open the chest, you activate the vagus nerve, a major nerve that connects your lungs, heart, and brain. Stimulating it helps calm the nervous system, lower blood pressure, and create a sense of mental clarity. It's one of the reasons you often feel calmer and more present after taking a few deep breaths with good posture. For those who want to challenge themselves a bit further, you can add a micro-pulse technique. Once your hands are clasped and lifted slightly behind you, make small, slow pulses, just a few centimeters of movement. This engages the stabilizing muscles between your shoulder blades, building endurance that supports good posture all day long. But remember, pain is never part of the goal. A gentle stretch and a calm breath are your best guides. Now that your shoulders are released and your spine is aligned, it's time to travel a little lower to the hips, the foundation of your body's balance and mobility. Because a flexible spine means nothing without strong, open hips to support it. 3. Seated hip stretch. For many older adults, back pain doesn't actually start in the back. It begins in the hips. When the muscles around the hips tighten or weaken, they pull on the lower spine, creating pressure that radiates upward. This is especially true for a small but powerful muscle deep inside the pelvis called the piriformis. It sits right behind the hip joint, close to the sciatic nerve, and when it becomes stiff, it can cause pain that spreads down the leg, the classic symptom people often mistake for sciatica. That's why this third exercise focuses on gently stretching the hips and lower back at the same time. It's a move that brings instant relief to those who spend long hours sitting. In Japan, rehabilitation specialists call it the seated twist of longevity because it keeps the hip joints flexible, a major predictor of mobility and independence after 60. Let's begin together. Sit tall on your chair with both feet flat on the floor. Slowly lift your right ankle and place it over your left knee, forming a number 4 shape. Keep your spine straight and your shoulders relaxed. Now, place your left hand on your right knee and your right hand on the chair behind you. Take a deep breath in, and as you exhale, gently rotate your torso toward your right side. Hold the position for 5 seconds, feeling the stretch deep in your hip and lower back. Return slowly to the center. Then switch sides. This may feel tight at first, and that's perfectly normal. The piriformis muscle is often one of the most neglected muscles in the body. When it's tight, you might feel a dull pressure or slight tingling down the leg, but when it's released, blood flow improves dramatically, and that nagging stiffness you felt when standing up from a chair starts to disappear. Now, let's talk about a few common mistakes. Some people pull too hard on their knees or round their back as they twist. That not only reduces the stretch but can strain the spine. The key is length before rotation. Sit tall first, then turn gently. Keep your chin in line with your chest, and let your breath guide you. Each exhale helps your body settle deeper into the movement naturally, without force. Once you feel comfortable with this stretch, you can try a slightly more advanced version. Instead of keeping your chest upright, lean your torso forward slightly while keeping your back flat. You'll feel the stretch intensify through your hip and glute muscles, the exact areas that support your balance and walking stability. Hold the position for 10 seconds, breathing slowly. Here's something interesting in a 2022 study from Kyushu University Hospital. Participants over 60 who performed daily seated hip stretches like this one improved their lower body flexibility by 28% after 1 month. But what surprised researchers even more was how it affected balance. By loosening the hips, participants reduced their risk of falls by nearly 20% because flexible hips help the brain react faster to sudden movements. When you finish both sides, take a moment to notice the difference. Your hips should feel lighter, your back less compressed, and your legs more stable beneath you. That's the foundation we want before moving to the next exercise, one that brings life back to the lower spine itself. Because when the hips are open, The back can finally move the way it was meant to. 4. Seated forward fold. One of the first things many people over 60 notice when back pain begins is that it's hardest to bend forward to tie a shoe, to pick something off the floor, or even to reach the edge of a table. The reason isn't just old age. It's the tightening of the hamstrings and the lower back muscles, which gradually pull on the base of the spine, creating constant tension. Over time, this stiffness can even affect blood flow to the lower back and legs, leading to that familiar heaviness many people feel in the morning. That's why this next movement, the seated forward fold, is so valuable. It helps lengthen the entire chain of muscles running from your neck down to your heels. The same chain that controls how you sit, stand, and walk. More importantly, it gently decompresses the spine, giving the discs between your vertebrae a chance to rehydrate and relax. Here's how we do it. Sit tall on a sturdy chair with your feet flat and slightly apart. Take a deep breath in through your nose. Then, as you exhale, begin to hinge forward from your hips, not your back. Let your hands slide down toward your knees, shins, or even your ankles wherever they naturally reach. Keep your spine long and your head relaxed. Hold this position for 5 to 10 seconds, breathing deeply, then slowly rise back up to sitting. As you move, try to notice the feeling along your back. The stretch should feel smooth, running from the base of your neck down through your hips. You might sense the muscles softening with each breath. That's blood and oxygen returning to tissues that have been compressed for hours, especially if you spend long periods sitting. Now, let's go over a few important doctor's notes. The most common mistake here is rounding the spine too early when you bend by collapsing the chest instead of hinging from the hips. That puts all the pressure on your lower back and defeats the purpose. To avoid this, imagine that your belly is leading the motion, not your shoulders. And if your back feels too tight, place a pillow or folded towel on your thighs and rest your forearms there. The key is gentle release, not force. If you've been practicing this for a while and want to go a bit deeper, try this advanced variation. When you reach the bottom of your fold, take 3 slow breaths and gently sway your upper body from side to side. This micro-movement massages the muscles along the spine and improves circulation to the nerves that run through the lower back. Some patients tell me that after doing this daily for a week, they start waking up without that morning stiffness that used to linger for hours. There's a fascinating physiological reason behind this. When the spine lengthens and decompresses during a forward fold, it activates a reflex that calms the parasympathetic nervous system, the part of your body responsible for rest and recovery. In simpler terms, this stretch doesn't just loosen your back, it relaxes your whole body. That's why you may feel your heart rate slow down and your mind grow quieter after a few rounds. When you're ready, well, move on to the final exercise, the one that ties everything together by releasing the deepest tension from your lower back and hips. Because real recovery doesn't happen in one muscle or one joint. It happens when your entire body moves as one. 5. Knee to chest stretch. By the time most people reach 60, they've learned to live with a certain amount of lower back pressure. It creeps in slowly after long car rides, after sitting too long at the table, or even after a short nap in the wrong chair. What many don't realize is that much of that discomfort comes from tightness deep in the lower spine and hip flexors, especially a muscle called the psoas. It connects the spine directly to the legs, and when it shortens, it pulls the entire lower back forward, compressing nerves and limiting movement. That's where this final stretch of the knee to chest movement comes in. It's one of the simplest, safest ways to release pressure from the lower spine, stimulate blood flow, and give the nervous system a signal that it's safe to relax. Think of it as pressing the reset button for your back. Here's how to do it. Sit tall on a sturdy chair with your back straight and your feet flat on the floor. Slowly lift your right knee toward your chest and clasp it gently with both hands. As you pull it in, keep your shoulders relaxed and your spine upright, Don't hunch forward. Hold the position for about 5 seconds, then release and switch to the other leg. Repeat 5 to 10 times per side. You'll likely feel a soft stretch deep in your lower back and the top of your thigh. That's exactly where we want it, the junction where the spine meets the pelvis. As the muscles release, the lower back decompresses and the hips regain their natural movement. Over time, this simple stretch can significantly reduce stiffness, especially in those who spend most of their day sitting. Now, let's go through a few common mistakes. The most frequent one is pulling the knee too hard or letting the shoulders tense up. When that happens, the neck and upper back take on unnecessary strain, which defeats the purpose. The key is gentleness. You're not trying to force flexibility, you're allowing your body to find comfort again. Keep breathing naturally and let gravity assist you. Once this becomes comfortable, you can try a slightly advanced version. Instead of pulling one knee at a time, lift both knees together and hold them toward your chest, wrapping your arms lightly around your shins. This version engages your abdominal muscles and adds a gentle massage to your lower spine as it rounds. It's an excellent way to strengthen your core while keeping the movement restorative. Just make sure the chair is stable and your back feels supported. Now, remember, consistency matters more than intensity. Doing these movements once won't erase years of stiffness, but practicing them daily, even just 10 minutes, can transform how you sit, stand, and move. Every stretch is a message to your body saying, "You're safe, you can move again." As we wrap up, notice how your back and hips feel compared to when you started. Chances are they're warmer, looser, and more alive. That's your body responding, rebuilding, and recovering one simple chair exercise at a time. And as your doctor, he'll say this motion is medicine. So, keep your chair nearby, and let these movements be your daily reminder that healing doesn't require perfection, it only needs persistence. Because once your back and hips move freely again, confidence follows right behind. If you followed along from the start, take a moment to notice the quiet transformation happening inside your body right now. The tension that once sat heavy in your lower back has softened. The stiffness in your hips feels lighter. And that dull, dragging fatigue that used to make every movement harder, it's starting to fade. Let's recap what you've just accomplished. With the torso twist, you helped your spine regain its natural rotation and reactivated the muscles that stabilize your core. Through the shoulder and chest opener, you restored posture, improved lung expansion, and reawakened your breathing rhythm. In the seated hip stretch, you unlocked one of the deepest sources of back tension, the hip rotators improving flexibility and blood flow to your lower body. Then, with the forward fold, you gently decompressed your spine, releasing pressure from your nerves and calming your entire nervous system. And finally, with the knee to chest stretch, you relieved the deepest layer of tightness in your lower back while activating your body's built-in relaxation response. Each of these 5 moves might look simple, but together they create a routine that targets every major area responsible for chronic back and hip discomfort. And the best part, you don't need to leave your chair. You don't need equipment, and you don't need to fear movement again. And if you'd like me to share the next level version of this routine, standing stretches that improve balance and strengthen your legs, don't forget to like, subscribe, and share this video so you can join our next session.